Welcome back. This is The Joy of Medicine. I'm glad you're here, and I'm here together with Dr. Richard Cashion, Dad, in my book, and then Caleb's over there working the magic that he works. So, welcome aboard. We've been a little bit off.
I've had flu A and then slow recovery and whatnot.
So we're looking forward to getting to this. It's kind of been a theme that's going on, and I think it really does fit. Frankly, because I've heard some issues, and it's come up even in our conversation with regard to somehow the diminishing trust that seems in general to be of physicians, healthcare in general, of the public. That's more probably just kind of what I sense. I don't know if it's necessarily true, but it does seem to be.
I think it is.
It seems to be some of that, and kind of want to put it in perspective because I'm a big believer that all of us and whatever we do are meant to, obviously, to see Christ in the people that we come in contact with. That's very important and difficult at times, depending on how nice they are. but the flip side is, I think, from a Catholic perspective, from a Christian perspective, from an incarnational perspective, God, in His glory, shares His image with us, and He asks us to be, to the best of our ability. We're not omnipresent. We're not all powerful. We're not, all the things that God is, but in our own way, I think we have not only the capability, but we have somewhat the obligation, the duty to do our best to try to reflect God to the people we meet in the way that
and part of our baptismal is sort of put us in that mode.
Right. You're priest, prophet, and king. And so by our baptism. And so I think one of the things that kind of bringing those two things together is, trust, and what does it mean for us to trust God? When I was raising kids, we talk about how important trust was, and I remember trying to explain to my kids. I said, "Well, trust means you can break trust in a heartbeat. I mean, it takes one thing to diminish the trust that you can have." But it takes time to build trust. Or maybe by your position, it's probably not the same way as it's been in the past. I see it in older people, myself included, but younger people.
I'm getting there.
But where trust is kind of given by your position, and I think doctors in general, nurses, people who take care of sick, by design, but certainly by necessity, because I mean it's the same as do you trust your mechanic? I mean, I don't know if he's doing what's right and fixing and I guess the same thing at a much higher and more important level happens with a doctor who's taking care of you physically. You don't know. I mean, I can't read a EKG or a scan or know.
Well, I can tell you for what you're getting to, the trust is very important. And there's been actually research done on that a couple of we talked about in Boston. The fact is, if you don't have trust, and another way to look at that is you don't believe it's going to work. So that's lack of trust. If you don't believe something's going to work, it has a high probability it's not going to work. But on the other hand, if you think it's going to work, there is a high probability it's going to work better than you anticipated.
Right. And not even just the whatever you're prescribing or recommending or doing to handle that, the trust actually at a higher level is actually the trust in the person who's making that decision.
Right.
And that does eventually come over time. But I do think that, at least in my age, and I think older, most people, if you go to a doctor, the assumption is I can trust him or her.
I think some of that's fading, and
I'm afraid it seems to be, and that's kind of what I wanted to bring back in. But I wanted to tie it with this sacramental. It's not a sacrament, but our lives are meant to be somewhat sacramental. I mean, in other words, what we do in our lives are meant to somehow be a sign to others of the presence of God by the way we handle, the way we act towards them, right? I mean, that's part of being a Christian. That's what we are his body, and we are meant to be kind of the physical, tangible signs in our words and in our deeds of who God is, right? I mean, we're supposed to reflect that to this world by the way we handle it. And so there's one of my favorite verses. I actually have a wristband that I wear all the time, and it has another place. We won't talk about it here, but I want to talk about. I'm going to read Psalm 37, 3-6, or maybe 3-5, and kind of talk about. It's talking about the Lord.
A funny thing, Trey. You know, I keep a journal of what I'm reading. Psalm 37, 1-6. I wrote in my book yesterday.
Yeah,
I didn't know I didn't know what we were going to talk about today.
And I have a wristband that is tied to something that happened in my life that it basically. I'll get to what it says, but it's basically a synopsis of this. But I'm just going to go ahead and read it, and I'd like, as I read it, to think, okay, it's talking about trusting in God, right? And kind of what that leads to in terms of how we respond and what we expect back from our trust with God. And I want you to think at the same time prayerfully about, well, if we're meant to reflect that, if you put, say, a doctor, Jesus is the great physician, right? I mean, that's a name that we use for him. If you put it in there, then kind of, I think there's a way to kind of put this in the context of a patient, a physician-patient relationship as well. Really everybody, but it's called the Joy of Medicine here. So
that's right.
We're going to do it. So here's 37:3 through probably 5. It says, trust in the Lord and do good, so you will dwell in the land and be nourished in safety. Take delight in the Lord, and he will give you the desires of your heart. Commit your way to the Lord, trust in him, and he will act. In my synopsis, the revised Cashion version of that kind of was something that hit me in the wristband has it's trust God, do good, and he will act. And I think that actually fits pretty well in medicine, because you have the side of trusting the physician. So the physician, why can we trust God? Because God does what he says he's going to do, right?
Well, there's some built-in trust. In fact, and for instance, like surgery, I had cancer of the lung like 8 years ago. I mean, when you're going in and they're going to put you to sleep, and in this particular thing, when they do your lung surgery, they have to put a tube down both lungs, one on each side, because they're going to take one part of the lung out. So that you're putting a lot of trust in them. They're putting you to sleep. They're cutting your chest open. They're cutting out the lung, cancer and whatnot. There's a lot of trust that goes in that. You just have to have the trust.
And I think more than at least at a high level of secular jobs, right. I think it requires a great deal of trust, especially at the more acute problems, right. Heart attack, cancer, anything that's, brain,
right.
Whatever. Not that it's not the other. I mean, the same thing goes when you're a young parent and you bring a sick child into a pediatrician. I mean, there's a certain, you're handing over your child to somebody. So you're trusting in them, but it's trust God, do good, and he will act. And so trust, like I said, and I've talked to my children about, is the way you gain trust is basically founded on I care about you, so I love you. God loves us so much, and he wills the good of the other, mm-hmm. which is a definition of love, right? He gives himself for the sake of the other, and that the other person knows, okay, well, he's going to deliver. It may not always be the way we like it. I mean, part of the trust is, one of my things is when you take the kids in when they're young to get vaccinations, right? I mean, they look at you with,
right.
Why are you alive? You're sitting there watching this person hurt me. I mean, because we know it's better. I mean, we know that it's good for you, even though it hurts. And that's a level of trust you have to have in God, but I think it's at the same time the level of trust that we have. The doctors, we have to presume, and doctors, I think, at their core need to say, my most important thing is the good of the person that's sitting in front of me. And I'm going to use what I'm capable of. I'm not God, but I have some wisdom. I understand. I've studied this, and these things tend to work. And I'm looking out for your best interests, even if it hurts. Mm-hmm. I know that surgery was not fun.
Yeah,
but it was helpful.
Very helpful.
Right. So, so I think that trust, that we trust in God, we can trust in God in a different way. We can trust in a doctor or banker or anybody else.
It's the same phenomenon. Right. Trust is trust, but the point is, obviously, it's at a higher level. When you move it, when you kick it up a notch, so to speak, like Emerald talks about it.
Right, exactly.
You kicked it up a notch. It's in God's hands.
Right, and so trusting, and then the doing good is, part of it is just that trust. I think at a lower level, when you're not talking about like a surgery, there's issues of compliance, right? A doctor says you need to take these medicines at this time and go get this test done by here and make sure it shows up. And those are things that need to happen in order for them to fulfill what they need to do so that you can trust them to make the right decisions going forward, right? I mean, compliance is an issue, right?
And I've actually commented on that. It's in part of the TROAS concept is there's the trust. It's actually responsibility. It's more than trust, that a doctor has the responsibility for doing the best he can, and the patient has the responsibility for following what he's recommended. Right. And that's equal.
Right. And that's part of I think a kind of a visible sign of, at a human level, of what we're meant to do in our relationship with God.
Right.
I mean, I'm trusting that this has happened. I've got to do the good. That's with trust God, do good, and He will act. I'm always asking myself, am I doing everything I can? And there are things I know I can't do. So I've got to be able to say, okay, that's where the trust comes in. I trust Him, and then I'm going to do what I'm supposed to do. But then I'm going to trust Him, because the last thing is He will act. If I trust Him and I do the good in front of me, He will act. So from a physician standpoint, I trust Him. He said, go get these tests done, take this medicine and come back to me in a month or something with all that done.
And in teaching in the medicine, a lot of times dealing with young doctors, and I taught in medicine for many years, one of the concepts is, am I doing what I need to do? Can I do this? And the answer is, what I always would tell them is, you've studied hard, you know the facts, you've looked at the patient, you've spent the time, so give it up to God and just do it.
Right.
Because you're on the right road.
And that's really part of it. I mean, I was dealing with my son who's in medical school and just saying, look, I think it's a great message, and from the standpoint that I think most of life is, you realize there's things you can do and can control. If you're honest, there's, even when you do everything that you can control, there are things outside of that realm. And so you have to trust that, okay, I've done everything, and whatever happens, in this case, God will act. And I've seen it so many times in my life.
Me too. Yeah.
Where you Jesus, I trust in you, which I know is one of our favorite simple prayers. It has to be followed by, what am I supposed to do? And then I go do it to the best of my ability, and then recognize, for the things that I can't do, He will act. And I think that at a sacramental level, again, being a doctor is not a sacrament, but I'm using the term.
But there's a lot going on.
I'm using the term to say that we're meant to be visible signs. So there's this kind of, I trust Him. That's why I went to Him. He's done these things. He's ordered these tests, whatever. I'm going to comply, take the medicines, go to get the tests.
But the actual trust is a medicine in itself, and I've seen that so many times.
Which is amazing.
Yeah. I mean, it is absolutely a medicine. It's people can't explain it or whatever, but when you see that they have great faith in what you're doing, whatever, things happen that you didn't expect to happen.
Well, and I know as a patient, because when I had COVID the first time, I was very sick,
Right.
and never had to go to the hospital. Not as sick as other people, but sicker than I wanted to be, and had a great doctor, and the thing, and have a great doctor still, but that doctor, what I recognize is when I trusted him, when I called to say I'm scared about this is happening in my lungs, I can feel these things, and the medicine that is in a voice that says, Trey, just relax. You're going to be fine. Go do this. In this case, he's like, go do your breathing treatment as I've recommended. Everything's going to be fine. And the stress level, everything that was going on in my head and in my heart, just from the voice of the one who was delivering.
And there's some physiology to go along with that.
I could feel it. It was tangible.
It has to do, stress causes a release of adrenaline, heart rate going up, all sorts of bad feelings, shaking, trembling, whatever. When you have relaxed, i.e. have trust in what is going on, the adrenaline levels go down, and that's been documented. And in fact, therefore, you do feel better because the adrenaline levels are going down. So it's actually people that don't even have faith can see it. That's happening.
Right. And so, and I think that kind of gets to the point, kind of, if we go to a priest for confession or whatever, the fact that we're hearing it, even though we're hearing it in the voice of another priest, I absolve you of sins, or here's your penance, whatever you need to go do. There's something about being human that says it's important to hear that calming voice. It's important to, because we're human, we need that. So we can go, and we should go straight to Jesus and to God and to anybody else that we need. But in the context of being sick, the voice of a doctor and the confidence of a doctor and the way that he delivers a message matters.
What you just said reminds me, thank you, God, I've been in a lot of emergency situations and dealing with crises. And the thing that I tried to teach the doctors, do not get excited. It's an exciting situation. Somebody's dying, and you have to think and do things fast. So you cannot get excited. Right. You have to learn to suppress that and deal with the issue in front of you. And as I remember one of my back a long time ago, so I'm sharing a little bit that happened. There's my hero in medicine is a guy that's died a number of years ago, a guy named Liston Beasley. And he was the old guy that brought me to Houston, Baylor College of Medicine. And so he used to follow me around to make sure I wasn't messing up. So one of the day we're walking down the hospital, it was a cardiac arrest. And I ran in and he just tapped me on the shoulder and said, take care of it. He didn't even walk in the room. So I went in, took care of the cardiac arrest, did everything. When I walked out, he said, you did great. And you know what the most important thing was? You didn't get excited. You just did what you had to do.
Right. And I hope for young, I would expect that most doctors realize that, but as a patient, I just know the impact that I could tangibly feel from a confidence level, from in the voice. You're going to be fine, Trey. You're going to be fine. To a trust that he knew what he was talking about better than I knew. And the level of medicine in reality, like that calming voice with confidence was at a human level as a sign of what we should have. I mean, we go to the Bible and read, that can be calming as well. But there's, in specific situations where you're sick, I think there is a part that says it's good for it to come from somebody who's in a position of trust. And
the reverse is also true. And that's one of the things I've hammered in my teaching the doctors that come in there. If a doctor comes in or a nurse and they are blown out of sight, I mean, they're obviously talking fast, their blood pressure's up, they're totally nervous and whatever's going on, that's transmitted to the patient. And I've seen it hundreds of times to where the anxious doctor can make the situation go from bad to worse.
I have a question.
Yeah.
What happens, and what would your advice be maybe if maybe from the patient's perspective, they have an upcoming procedure or something, and they've kind of lost some of that trust. Maybe there have been clerical errors in the doctor's staff or something like that, and so they are kind of questioning the competence. That mistrust or that breaking of trust has kind of transferred over into their whole feeling about like the doctor or things like that. I hear about things like that happen a lot. They mess up your prescription. They schedule the wrong date, or they give you the wrong prep or whatever. What would your advice be to maybe the patient who's lost some trust in?
That Trey mentioned that earlier in the broadcast. It is very easy to lose trust. So that in that situation, something happened that made you lose trust in that doctor or that situation. Very easy to lose it, hard to gain it back. So the answer to the question is you have to do your best to listen to the doctor and do it and express your confidence in the doctor. I think that's probably, as a patient, that's the best thing is actually looking straight in the eye and say, look, doc, I have confidence you're going to help me. And that, that's the reverse of that's true. That gives him or her confidence that, in fact, what they're going to do is going to work.
Yeah, and I think just from a common, if there have been mistakes made, I mean, part of, and sometimes people cannot be good at this. I think saying we messed up, we're working. I think that's important on something like that. I mean, to be openly contrite, like I don't know what happened. It was my fault. It was whoever's fault. It doesn't really matter. It impacted you. I think be a human to another human when that's happened. I think that helps restore it. But trust is something like I said, you can lose it in a heartbeat, but to build it up, or to regain it takes delivering like you were trustworthy. How do you know you're trustworthy? By, well, what did they say? What did they do? Were they honest with me? Were there things that they didn't tell me? I mean, so it is something that
takes a long time. It takes a long time to build
up, and then I think it takes a long time to restore. Right. And I think this is just human. I'm not a doctor, but I think just in human relationships, when trust has been broken, you've got to be hyper vigilant if you want to restore it, to say something has caused a rift here. I need to make sure to the best of my ability to do what I should always do, but especially to try to restore that with them. So it may start with a sorry, but then it's like I responded.
And to get to Caleb's question, it's hard for the patient to do that. You have to, again, have trust in the doctor, but you can make a comment that I'm worried about such and such, and things don't look like they're doing well. What can I do to make things better?
Right. And then I think on a show like this, and we've talked about this before, to incorporate a trust in God, in reality, into it. Okay, I don't know if you've done a lot of that in your practice, but to say, look, I'm going to do everything I know. I've been trained. I'm going to do everything for you, but let's also let's add or invite God into the mix here.
And getting back to Caleb's question, I can remember the time. I can actually remember it right now. It happened many years ago when a patient came to me and he said, "Doc, everybody's done everything. Can you pray with me?" That was one of the most eye-opening, wonderful experiences I ever had. So you can ask the doctor to pray with you.
Right.
And that sort of brings the great physician into the picture.
Which I think adds the most appropriate level of trust, because as humans, you can be a great doctor and do everything, and still things can go wrong, and it not even be your fault. I mean, it just something happened, and so to incorporate that is the way that medicine ought to be handled. There should be this idea of, I'm going to trust God, and then I'm going to allow that to be kind of sacramentally by trusting the physician in front of me, and the physician's got to say, I recognize that I'm kind of standing in a symbolic way in the space that Christ would normally be, and so I have to take seriously the fact that I owe them being most concerned about what's right for you as a patient, I also owe them even if they won't pray with me, that I need to trust.
Well, that's what, getting back to Caleb, that sort of kicks it up a notch and puts it in a different perspective. Is telling the doctor, look, I trust in you, but we need some help here. Right. And that prayer, I can remember that to this day. That happened many, many years ago. But that was like an eye opener. This patient was saying, "Doc, let's pray."
Yeah, no, and I think
that's okay to do that.
Okay? Right, and I think the fact that we need to not be afraid, whether we're a patient or a doctor or whatever, to in our faith to just be open about it. I think there's something in the culture that says there's something wrong with that. I think we need to be bold
it's funny,
enough
Trey.
to not.
People, and certainly young physicians may worry, how do I get into that realm? And I've mentioned this before on the radio, so you can go back and listen to it again. But the point is, one of my favorite things to do is ask the person, when you're in trouble, who do you talk to?
Right.
I mean, really trouble, not just something little, but if you have some major crisis, who do you talk to? And if they say Uncle Bob or Aunt June or something like that, you're in a different realm. But if they say, I pray to God, then the door's open.
Right.
So use that door.
Right. No, I think that's a great way to do it. But I know, we're drawn to the end here, and I think I want to just tie this in but all of us, but I think physicians in a particular way have the opportunity, I would say even the duty and the obligation to recognize the reality that God's put them in a particular place as a representative of His, so that people might come to know Him a little bit more deeply by your treatment of them. So it's more than just taking care of the stuff, more than just taking care of that. I think a good Christian doctor is somebody who is willing to consciously say, I have a responsibility to God and to the patient to be kind of an intermediary in this moment. And I have to believe that will produce joy if we can recognize that and be conscious about it. I think half of being a Christian is we lose sight. We get caught up in the stuff, right? The stuff that's going on, and we lose sight of probably the most important thing, which is that God's involved in whatever we're doing. He's here now. And we're a part of His plan in that moment. And I think that perspective gets lost sometimes. Mm-hmm. And we need to kind of consciously say before we walk into a room to see a patient or whatever, even if it's an emergency, just quick, Lord, I need your help on this. I'm going to go do my best. What that's 10 seconds as you're walking can be something.
God doesn't need time, so you can make it short.
Right, very short. I mean, Teresa Lisieux always said that a prayer is just a simple glance towards heaven. So she didn't make it into like it's saying 10 Hail Marys and 20 Our Fathers. It was just a glance towards heaven. So as a physician, you can do that. But
many times I did.
Yeah, and I think we should. But I just want to say, recognize that you're meant to be a way that God conveys. If you're a doctor or a nurse or anybody in healthcare, or really anybody, that you're meant to be a sign that shows somebody what trust is really about. Recognizing that we fall short, but that we're trying to say, your best interest is what I'm going to use my gifts for what's good for you. And if we do that and recognize that we're a part of the plan, then I think joy flows from that. I mean,
Amen.
So anyway, with that, we'll end. Thanks for listening, and we'll see you next time. God bless. Bye.